From KPRC 2 News, this is a live Ask 2 Town Hall. Coronavirus vaccines.
And good evening, everyone. I'm Cambrell Marshall.
And I'm Christine Noel. We appreciate you joining us for this special live Ask 2 Town Hall on coronavirus vaccines.
Over the next hour or so, we'll be joined by a group of experts and public health officials, all working to separate fact from fiction when it comes to the safety, the efficacy, and availability of the vaccine. They're here to answer questions submitted by you.
Yeah, very important conversation. And joining us tonight is Houston Mayor Sylvester Turner. He serves as the executive officer of the city. He has been front and center in the city's effort to stop the spread of COVID-19 and to keep the public informed.
Imelda Garcia is an associate commissioner for the Texas Department of State Health Services Division for Laboratory and Infectious Disease Services. Garcia also serves as the chair of the expert vaccine allocation panel.
Dr. Ashley Drews is a specialist in infectious diseases at Houston Methodist.
Dr. Marla Fielder is responsible for the Kroger Division's pharmacy operations, which includes more than 106 locations in Texas and Louisiana. Her pharmacy teams have administered several thousand COVID-19 tests, including drive-through testing sites in partnership with the City of Houston, Harris County Health Department, as well as Montgomery County Office of Emergency Management.
And Dr. James McCarthy is the chief physician executive at Memorial Hermann Health System. Dr. McCarthy is coordinating all of the vaccine efforts for the hospital.
Stephen Williams is the director for the Houston Health Department. He served in that role since 2004. He's also on several boards of community, professional, and civil rights organizations as well.
And a bit later, we're going to be speaking with pediatrician Julie Boom. Dr. Boom is the director of the Texas Children's Hospital Immunization Project and serves as co-chair of TCH's COVID vaccine task force.
We obviously have a lot lined up, so let's get to our panel tonight. Thank you all for joining us this evening. Our first question is for Mayor Turner. Mayor, Lisa asks you, how do people who do not have insurance or go to a doctor get a shot?
Well, just bear in mind, and thanks for having me with this distinguished panel tonight and be with you all. Let me just say that this vaccine is free. So it's not costing anyone, whether you have insurance or you don't have insurance. It does not matter. So if anyone is trying to charge you for something for this vaccine, just know that that's a no-no. And then, of course, with the City of Houston Health Department, Director Steve Williams is on the panel tonight. We're trying to make these vaccines available to everyone throughout the city of Houston, especially to communities that are underserved, under-resourced, low-income communities. It doesn't matter where you live. We're trying to make it accessible to everyone. But again, no charge for this vaccine.
You know, you talk about that, and I noticed that making it accessible. What about people who may not have transportation? Do you have opportunities to do that? I know sometimes you ramp up and you can help people get to those sites. Is there something like that in place, or is that something being thought about?
Well, we're trying to deal with the distribution of this vaccine like we have done with testing, and that is we have fixed sites throughout the city. You can go to several of our clinics. We're currently providing this vaccine in 4 of our clinics already. We're trying to set up mobile sites. Again, all of this is contingent on the availability of the vaccine. And then in some cases, for people who are transportation challenged, homebound, we're trying to put ourselves in a position where we can go to one's residence, one's home, and provide this vaccine. I'm very proud. We have some very creative folks at the City of Houston Health Department, and Director Williams and his staff have done an outstanding job of trying to make this vaccine available. We're just waiting on the additional supply.
And Mayor, pivoting now, thank you for that. I want to go to Stephen Williams with the Houston Health Department. Can you speak more on that? What is your department doing to make sure that every community is getting access to these vaccines?
Well, just to reinforce what the mayor is saying, we have at least started to distribute vaccines at 2 what we call mega sites. One is at the Bayou Center, which is located in the south part of Houston. And over the last weekend, we were able to distribute a little under 4,000 vaccines at Minute Maid Park. We do plan to have another mega site at Minute Maid Park this Saturday. In addition to that, we have vaccines available and administration available at our 4 multi-service centers, which are strategically located throughout the city. Starting next week, it is our hope that we're actually going to expand our distribution network to include at least 2 Walgreens locations that are in what we call high priority zip codes, and those are zip codes that have high positivity rates. Also, the mayor mentioned we're in conversations with a provider to do in-home vaccinations. In the Houston Health Department, we run the Area Agency on Aging, and they primarily serve individuals that are 60 and above. As with testing, we were able to contract with a vendor who went into individuals who had mobility issues, homes, and provided testing. We plan to actually repeat that for vaccinations.
Sounds like a lot going on there. Obviously, it's just a matter of taking time to get that done. Imelda Garcia with the Texas Department of State Health Services. We want to turn to you next. John Z has a question for you. He says, it appears that the big voting areas are getting the vaccines at a disproportional rate at the expense of smaller counties. He says it isn't fair. Is his assessment correct?
Thank you for that question. As you all may recall, we have had a targeted population to receive vaccine across the state. And so the first priority for us to do was to protect our healthcare workers. Obviously, where the large healthcare infrastructure is across the state largely focuses in the big urban centers. And, with the Houston, Harris County having a very strong contingency there. And so we were doing targeted allocations to a lot of hospitals directly to protect their frontline staff that were working directly with COVID-19 patients. But since then, we have started to pivot and are now opening vaccinations to the 1B population. And so this is everyone that's over 65 and anyone that's 16 and older with at least one chronic condition that makes them at higher risk for COVID-19 severe outcomes. So with that pivot to this broader population, we are doing a more targeted outreach and broader distributions moving forward. But as the mayor mentioned, all of our distribution is really based on the supply that we have from our federal partners. And until we get more vaccine supply, the availability will still be sparse across the state in general. But that being said, we get more and more vaccine every single week. And that will continue to happen over the next coming weeks. And so we urge you all to be mindful of that. We're continuing to push out new allocations to more and more rural communities all across the state. I think when you all see the upcoming week 6 allocations for January 18th and beyond, you'll notice that we have a much more robust rural community allocation strategy.
Ms. Garcia, thank you for that. This next question is for you as well. And speaking about the vaccination and the supply, viewer SC asks, when a business receives an allotment of COVID vaccines, is it up to them who to give it to, or are they required to follow the 1A and 1B guidelines for vaccine distribution?
So yes, we do expect all of our COVID-19 providers to follow the state's guidelines on who is eligible to receive the vaccine. And so for right now, those are 1A, our healthcare workers, and 2, that over 65 and those individuals with at least one chronic condition.
All right, thank you very much. Dr. Marla Fielder with Kroger, a question for you now. Who can get vaccines from a Kroger store? We already know 1A, 1B is a category. Does that mean that it's a customer at Kroger, or how do they get into line to get a vaccine at your store?
Sure. Thank you for the question, and thank you for having me. Certainly everything is allotment dependent today. All of the vaccine that we have received so far, the 6,800 doses that we have received, have already been allocated to many 1A workers. And then we have quite a few 1B patients or people in the 1B category that have received their vaccine as well. Certainly in the coming weeks, I'm very excited and hopeful and patiently waiting, as everyone else is, for those allotments, and we will be able to offer those vaccines to a broader community, still within the state guidelines.
Any timeline for that, and will it have to be by appointment?
It will need to be by appointment, and that's just basically due to the viability of the product. We need to make sure that we're able to get all the doses given after the vial has been punctured in the allotted time. And so that will, as well as allow for us to continue to do our core business that we do every day. So those that aren't quite ready to get their vaccine are still expecting their prescription to be filled in a timely manner. And so we have the appointment piece is very critical to that role. As more allotments come out, we are working and partnering with city and county officials in the surrounding areas to have bigger scale clinics so that we can get those doses to more people more efficiently.
Thank you very much. Memorial Hermann, by the way, made big news tonight. We saw that earlier on the newscast by saying that their vaccine clinic at NRG Park will now be open to public for anyone 65 or older. And at that point, there were 10,000 spots available. We received word just a short time ago that all 10,000 spots are now booked. Clearly, a huge demand for the vaccine. Dr. McCarthy, can you talk about Memorial Hermann's efforts to reach more people?
Sure. So thank you first for the opportunity to be with you all tonight. And many members of the panel have helped us in our efforts, Dr. Garcia, specifically with their helps at the state level for allocation. So, as many folks have mentioned, our initial efforts were focused around the 1A. So that was not just our employees and our physicians, but also community medicine response, our school-based nurses, as well as our independent private physicians, their office staff. So that was really our initial focus. As we pivoted and started bringing 1B in, we contacted the patients we knew first, got them in, started that process. But as we were looking for how we could expand and meet our obligation to the community, we looked at some of the larger scale events that we might be able to do. And we were inspired by the work that Houston Food Bank did down with their partnership with NRG. So in combination with NRG and the Houston Rodeo, we put together a program over the next 4 days, and we'll be vaccinating about 14,000 people all in. About 1,000 of those will be volunteers helping us get this process. We got 700 volunteers getting this process up and running for us. But then we did an open link that we put on our social media pages this afternoon about 1 o'clock. By about 5 o'clock, it was completely full. 10,000 slots have been just gobbled up. We're asking just that people attest that they're 65, that they present with an ID showing that they're 65, so that we can be sure that we're consistent with the state's guidelines. We've chosen initially just to focus on the 65 and over because they're an easy group to identify and get the process rolling. And just to put that into perspective, the greater Houston area has got over 800,000 people that are 65 and older. So it's going to take us a little time to work through that population. And we know everyone wants it today, but we're enthusiastic to be getting this rolling, but we're going to need a little patience as a community to work through the entire population.
Yeah, certainly, Dr. McCarthy, thank you for that. This next question goes to Dr. Ashley Drews, an infectious diseases specialist at Houston Methodist. I know Houston Methodist also has a plan to vaccinate thousands more in the coming days and weeks. In addition to distribution questions, though, we're hearing some other commonly asked questions about the vaccine itself.
One viewer asked us, should you get the vaccine even if you're still infected? Very interesting question. I've heard that before as well.
Yes, that is a great question. It is important to receive the vaccine even if you have been infected previously, because the immune response that's induced by the vaccine is much more robust than just natural infection. So we do recommend that all persons are vaccinated, whether they have had natural infection in the past or not. But we do not recommend that you get the vaccine while you are actively infected. There's not a prolonged waiting period, but you need to wait until you've resolved your infection, you're afebrile, and out of isolation before you come to a vaccine clinic to receive that vaccine.
And that leads us to our next question. Diane asked, should I take the vaccine even if I still have COVID symptoms? She says, I had COVID in early October, but still have congestion, post-nasal drip, and can't sleep at night. So should they get that vaccine if they're still displaying symptoms?
Yes, that's a great question. I think a lot of people have heard about the prolonged symptoms after COVID, and that's one of the main reasons that we are recommending vaccination, is to prevent COVID and its long-term complications and long-term symptoms. And so those symptoms that are lasting longer are not related to active viral infection. They are just a sequelae of having had the infection. And so, yes, you should receive the vaccine, and that would not be a contraindication. Just because you're still having some symptoms from your prior infection would not preclude you from having the vaccine. And you should go ahead and receive the vaccine as soon as it becomes available to you.
All right, we appreciate the panel's insight so far. Be sure to stay with us. We're going to be answering more of your questions on availability as well as distribution. And coming up next, we're going to be joined by Dr. Julie Boom from Texas Children's Hospital to answer your questions about vaccines when it comes to your kids.
And we want to make sure that you know that every day the KPRC 2 News team is compiling the day's biggest coronavirus headlines, as well as getting answers to more of your questions. It's easy to sign up for our daily newsletters. Just enter your email address on clicktohouston.com/newsletters. We'll be right back with more from our experts in this live Ask 2 Town Hall right after this. And welcome back to this Ask 2 Town Hall coronavirus vaccine.
Yeah, we appreciate you joining us, and we are looking forward to getting back to our panel in just a moment. But first, the vaccine is not yet available for kids, but it is still top of mind, certainly for many parents out there.
Dr. Julie Boom from Texas Children's Hospital is the co-chair of the Texas Children's Vaccine Task Force. She's here with what you need to know about our kids and the COVID vaccine. Question is, do we know when the vaccine may be available for kids, Doctor?
So right now, the vaccine is available for teens 16 and up with a chronic health condition, and trials are underway right now for children of all ages, even here in the Houston area. And we're very hopeful that within the coming months that all children will be eligible for the vaccine.
And Dr. Boom, what can you tell us about the safety and the effectiveness of the vaccine for kids?
Absolutely. We're waiting on the results of those clinical trials to learn more about safety and effectiveness for children. But we do know from the adult studies that these vaccines are very safe and effective. Regarding the effectiveness, so far they're about 95% effective, which means that they give excellent immunity to about 19 out of 20 people who take them. And they've also been very safe. Even though you may have some soreness at the site where you receive the vaccine or maybe some fatigue, these are actually good signs that show that your immune system is really rising to the occasion and it will be ready when the real disease arrives.
So the question now is, how will families know, for example, when they can access the vaccine? You say it's effective, it's going to be fine, but how will they know when it's time to access that vaccine?
So for Texas Children's patients, we're actually reaching out to our patients who are eligible to receive now the vaccine, those 16 and up with chronic conditions, based on two things: the state's eligibility criteria, and also we've established an equitable allocation framework, and we are really using both of those elements to reach out to our patients.
And Dr. Boom, what do you want people to know about kids and the COVID vaccine if you had to leave them with a lasting message about it?
Absolutely. If your child has the opportunity to receive one of these vaccines, whether it's now or in the future, please take advantage of that opportunity. It is so important to develop immunity against this very severe illness, and we want every child to have that. So take that opportunity as soon as it comes.
All right, Dr. Julie Boom from Texas Children's Hospital, we appreciate your insight tonight. Thank you.
Thank you.
Also tonight, we are asking questions submitted by viewers hoping to get help and answers about the coronavirus vaccine.
Let's bring back our main panel of experts now. Our guests tonight represent the city of Houston, the Texas Department of State Health Services, Houston Methodist, Memorial Hermann, and Kroger as well. Mayor Turner, you received the first dose of the vaccine recently. I have to tell you that I received my first dose yesterday, being a senior citizen, so I'm eligible in that category. What's your message to those who are wary about getting the shot, especially those of color who have been known in our communities to be a little bit suspicious about these kinds of things?
Well, I would tell you, this is one of the times that you don't want to hide being a senior citizen, okay? This is one of the times, if you're 65 or older, you better claim it.
Yes, sir.
Let me just say, I think I'm on day 9 since taking the vaccine. I didn't have any problems. I've not had any problems, feel fine. So that's a personal testimony. What I will tell you, though, that almost every day when I give out these numbers, people of color, African Americans and Hispanics are showing up quite a bit in the numbers. And so I'd rather take my chances with the vaccine than to take my chances with this virus. Too many people have gotten sick. Too many people have died, and especially African Americans and Hispanics. So my advice would be, please take advantage. Don't wait and come in on the back end. As you can see, there's a huge demand. There are a lot of people who are wanting this vaccine. So don't delay. Don't put it off. Protect yourself, protect your family, protect your friends.
You know, one in 4 Black residents, 45% of Latino residents lack health insurance. Those numbers expected to climb here now. How much of an impediment do you think that'll be toward that portion of our community being able to get these vaccinations?
Well, the good news is that this vaccine is free. Our charge is to make sure that there's equity in distribution. So we want to make sure that there are not access issues, that you don't have a difficult time accessing the vaccine because you have transportation issues, because it's too far away from you. Those are the sort of barriers that we want to eliminate. That's why I'm very proud of the City of Houston's Health Department by providing this vaccine at different clinics throughout the city, working with FQHCs that are close to these communities, working with the pharmacies that are in these communities, providing mobile units based on the availability of the vaccine, and in some cases being able to take the vaccine to people's homes themselves. So we're going to do everything on our end to make sure that regardless of your social economic status, regardless of where you live, we want to make sure that you're not at the back end of the line. We just need your assistance in taking advantage of it when you become eligible for it.
Thank you, Mayor. Appreciate it.
Yeah, now to a couple of questions for Stephen Williams with the Houston Health Department. Mr. Williams, viewer Claire asked tonight, my husband and I got our first COVID vaccine shot through the city of Houston. How do we schedule our second shot that's due on the 6th of February?
Actually, those people who got their shot through the city of Houston will be contacted and given either a location or a way to get that second shot. I know that there is a lot of anxiety out there about taking the second shot, but don't worry about it. We will be in contact with you. We're really making real specific plans of how to follow through and ensure that you get that second shot.
All right, thank you, sir. And, we've been posting the state's vaccine allotments every week right here on clicktohouston.com/vaccine, showing the local pharmacies, the hospitals, the doctor's offices, and public health departments receiving vaccines from the state, the brand and how many of those things. Gary Hiles is asking, when you look at the COVID vaccine map, you pull up a provider and it says 400 vaccines, but they used 140 and then 260 in reserve. Ms. Garcia, for you, can you explain what do these numbers mean? Are the second doses being held?
So thank you for that question. Right now, both of the brands of vaccine that we have available to us require 2 doses. And so there are allocations that are made for the first dose, in which case we don't want any of those doses being placed on a shelf and waiting. We want those doses to be used every single week, and they need to make sure that they run through it. However, they have a separate allocation for those second dose, for those people that received it the first time, and they need to come back for the second time. And those are dedicated to make sure that those that got it earlier can have the full protection of the vaccine. And so that is why we are just making a distinction between the two. Now, it's important to remember that the doses allocated and the doses that may be remaining on the website are at a specific point in time. And so it's important for you to reach out to the provider and check to see what the current availability is, because sometimes the information we have may be a couple of days old and they may have already run out. So that's where we encourage you to check the website and call the providers and see what is currently available.
All right, thank you so much. We have about a minute left. One quick question for our entire panel. Let's see who can help with this gentleman or this woman. Diana Milbreth says, my husband is 79 years old. I'm 70 years old. It's been impossible for both of us to schedule a COVID vaccine. We're both in the high-risk category and afraid to get infected with this virus. What do you suggest to them? We have about 30 seconds to do so. Who wants to take it?
Well, I'll jump into that. And the help is coming. Right? Increasing vaccines are available. Increasing access will be, whether it's our partners who are running large-scale pharmacies like Kroger, whether it's the large health systems like the Methodist system, Memorial Hermann, Exit Children's, as more vaccine becomes available. Now that we have finished with our frontline medical workers for the most part, we will increasingly have this available for the general public. And I know that everyone wants this today, and I would just remind everyone out there that it's been less than a month that we've had this in our hands. The first shot I saw.
Dr. McCarthy, we're out of time now, but thank you so much. We thank everybody who's watching. Stay with us. We've got more online. clicktohouston.com. Welcome back to our second half hour of our Ask 2 Town Hall, live now on click2houston.com and Facebook. Different kind of feel, but still the same sort of information. I'm Cambrell Marshall.
And I'm Christine Noel. Take a breath, enjoy the conversation. It's certainly an important one to have. We are joined tonight by a panel of experts to answer your pressing questions about the COVID-19 vaccines. Our guests tonight represent the City of Houston, Texas Department of State Health Services, Houston Methodist, Memorial Hermann, as well as Kroger.
Let's bring in our panel. We've had a lot of questions about second doses tonight here. One of them is from Dalton, who writes, I'm a home health care provider. I'm due to get my second dose in about 10 days, and I can't find any appointments. I know I'm worried I won't be able to get a second dose on time. What should I do? Ms. Garcia with the Texas Department of State Health Services, would you take that one?
Sure. So our weekly allocations for second doses are just starting to occur for those that have received it like the week of Christmas. So those, as they arrive at the locations and they know they have them, they will be proactively reaching out to you all to receive your second dose. Now, that being said, the second dose does have a window period of time. And so even if you don't get it on the exact day that you're supposed to, we want you to come back in. Even if it's a few day early or a few days later, it's important to come back in for that second dose. So even if you don't hit it specifically, please make sure you get that second dose.
And Ms. Garcia, this next question is for you as well. A viewer asked, does the state have a plan to ensure the second vaccine shot is available because getting the first shot was not easy?
Yes. So we have been working very, very closely with all of our providers to reassure them that the second dose allocations will be coming so that they have that guarantee and will be able to work with the provider, work with the patients to be able to get them back in for that second dose. Obviously, the vaccine supply is always the limiting factor. But right now, the second dose is a guaranteed shipment to all the providers that have already received vaccine. So we want to encourage everyone to continue that. We will continue to work with the providers across the state and our local communities as new information comes available, that we will be sharing that forward.
So for our doctors on the panel here, this is another follow-up, has to do with the second dose question here. MJ is asking if second doses are not safe for initial recipients, what's going to happen to all the folks who got first dose but can't get a second? Won't the first dose be wasted? Will they have to start again? I've heard that question asked before. This is uncertain territory. We haven't gone down this road before, so I guess you can understand people might have that kind of question. What if for whatever reason you don't get the second dose right away? Will the efficacy be lowered?
Oh, I could take that one. Actually, it would not be. So we certainly are encouraging people to get their doses on schedule as much as possible, because the sooner that people receive the second dose, the sooner they'll have the full protection and the full benefit of the vaccine. But if for some reason you're not able to get access to the second dose, you certainly can receive it at any point later, and you will still receive the full benefit of the vaccine. You don't have to repeat your first vaccination. You'll just receive that second dose as it's available to you, and you'll still get the full benefit of the vaccine.
So I have a question as well for the doctors there, because I was telling the mayor, you saw in my first half hour, I got my shot yesterday. By the way, if it wasn't for the fact that I had a Band-Aid on, I wouldn't know I got it. So
I was gonna say, how do you feel?
Fine, no problems whatsoever, just fabulous. But they told me that when I come back, that I won't get the full benefit of the vaccine until 14 days after the second shot. And so do we know anything about the efficacy of the shot? Does it do anything for us after the first dose, or do we have to wait until the second dose before we have any protection at all, any of the doctors?
So in both the Pfizer and the Moderna trials, when they did the vaccine studies, they saw for about the first 10 to 14 days, there was no difference between the persons that received the vaccine and placebo. So there was not any separation. But around the 2-week mark, they started to see some difference in the people who had received the vaccine. So it does start to have some impact, even from the first dose as early as 2 weeks. But it is really important to receive both doses to have that full preventive effect.
All right. And also, Deborah is asking, this also goes to all of the doctors on our panel. She asks, if I've already had COVID-19, Do I still need to take the vaccine? And this is a question that a lot of folks have. Y'all, I just recently recovered from the virus myself. I actually woke up with it on Christmas. So I know that so many others can relate, having battled COVID as well. So for those who have recovered from coronavirus, do we still need to get the vaccine?
Yes.
Yes.
Yes, yes, yes. We know that people can be reinfected with COVID as time goes. We think that we have some immunity that lasts out to at least 90 days, but beyond that, it's very variable. So we're recommending everybody, even if they have had a confirmed COVID infection, be vaccinated.
Yes, as the pandemic is wearing on, we are seeing more people who have had COVID that are actually reinfected, so getting it a second time. So natural infection does not produce long-lasting immunity in all, and the vaccines induce a much stronger and more robust immune response. So it's important, even if you've had COVID-19 before, to receive the vaccine.
To Dr. Drews or Dr. McCarthy, how long do we have to wait? If I just got over it and tested negative for the virus last Thursday, if it were available to me, how long would you have to wait to get the vaccine once you recovered from the virus?
So there's no minimum waiting time. Once you've recovered, if the vaccine is available to you, then you are able to receive it. You're eligible. So you need to be afebrile, obviously, and no longer in isolation with active COVID. But once that has resolved, then you're able to get the vaccine without any waiting period.
All right, thank you so much. This next question goes to Dr. James McCarthy with Memorial Hermann. Going back to him, Daniel asks, if you have the first shot of the vaccine, would that create a false positive in a test?
No, the testing that we do to look for active infection is very different. If we're looking for evidence of the virus itself, and the antibodies you generate from the vaccine will not trigger a false positive.
You know, I'd asked that question yesterday when I was getting my shot because I've been traveling, I wanted to get a test. So I think that's very important for people to understand that it does not have, they made the point to say this does not have any active coronavirus anything. So you can get that test. Mary asks, are the first and second Moderna vaccine doses identical? Dr. McCarthy?
Yes, the first doses, the two doses we're using for Moderna are identical. The first dose and second dose are the same exact dose. They're the same exact product. They're just given 28 days apart.
All right, thank you so much. Okay, this next viewer question, it's actually a two-part question here. So if a family member living in my house tests positive for COVID-19, but I had it in June of 2020, first part of the question, can I get it again? And two, should I quarantine? Doctors?
So yes, you can unfortunately get it again. Unfortunately, it's not just a one-time infection. We are seeing, as the pandemic goes on, more people who are getting it twice. And so you are at risk of getting it again. That's why we're recommending vaccination for everyone. And if you've been exposed, then yes, it is still recommended that you quarantine.
All right, thank you so much for that. All right, so to our next viewer, Dennis Lee Miles, he says, why are some vaccine distribution locations allowed to discriminate as to who is eligible? So, Mr. Williams, this one is to you. What would you say to people who say that the allocation isn't fair, such as hospital groups giving shots to only their patients?
Well, initially, as Imelda mentioned, the hospital workers were in that 1A category. And so they were prioritized. Shortly after that, as you know, we began to get a certain level of penetration within that 1A healthcare workers group. We developed the 1B category, which included people that are 65 and above, and those individuals that's 16 and above with chronic conditions. And the reason for that is to ensure that those individuals who are likely to suffer more consequences from COVID were in fact vaccinated. We know that when in any process that there are going to be some people that do not follow the rules. And what I've observed, though, certainly at our clinics, is that most of the people, more than 95% or more of the folks that actually presented themselves for a vaccine met that 1A or 1B category.
Mr. Williams, thank you. And to Ms. Garcia, how would you explain the process so far to this viewer dentist who wrote in saying that the distribution locations, why are they allowed to discriminate as to who is eligible? What is your response to him?
So as a state, every single provider that signed up to provide COVID-19 vaccine attested to following the rules and the guidelines, not only that CDC outlined, but also the priority populations that the state outlined. And so we keep reiterating that message across the state with all of the providers and all of the communities. Now, that being said, as Stephen said, there are people that may not be following the rules. We do want to know about those scenarios. We do want to be able to follow up with those providers and educate them about who is eligible right now. Now, that being said, how the providers are able to get through vaccinating right now with a very limited supply. We have given them flexibility because there is such a small supply. And so that's where knowing that you're eligible and knowing where the providers are that are in your community is really important, and look for those locations where you can find access. We're going to get more vaccine every single week, but we're not getting a lot every week. And so just keep that in mind, that it's still a scarce resource right now. And so we ask that you all be patient with us. And in the meantime, we got to keep up our preventive measures. We got to keep wearing a mask. We got to keep social distancing. All those things are going to be really important for us as we continue vaccinating our communities.
And Ms. Garcia, another viewer asks and says, my husband and I are both 77. He has COPD. We spend 6 months in Texas and 6 months in Ohio. Can we get the vaccine here? They say their legal address is in Ohio.
So we do not have any residency requirements in order to receive the vaccine. So yes, you would be eligible to receive the vaccine here.
Okay, I'm going to pivot a little bit and talk to Dr. Fielder from Kroger. Meredith Clark let me ask you this. You've got a great opportunity as a distribution center. What is the challenge in making sure that you can get the product out to customers in an efficient way so that they can understand that your place is where it can be received and done in an efficient way?
Sure. So I think the biggest challenge for us is really supply and demand. I think we've heard it over and over today. And that is where every entity that has doses, where they are. And so we absolutely have done vaccines time and time again for many years. And so the process of vaccinating is not foreign to us. What is different for us and everyone is, of course, the demand piece. And so we are flexible and nimble. We've had to, I don't know how many times I've had to say pivot, but pivot numerous times for the best plan to get as many doses into the arms of our Houstonians as possible. And we continue to do so. There's a day or two that I felt like maybe we Euro-stepped for the basketball fans out there. But we just continue to be flexible and nimble, and we just ask that our patients and community does the same.
Here's another question for our providers here. Meredith Clark asks, wouldn't it be a good idea to have standby list with vaccine providers in place so that no doses are wasted for no-shows, for example, people who could be on call and are close by? Is that something that's thought about?
We absolutely do that at our sites. We have a standby list towards the end of the day. If we realize that we have a little bit of extra, we call those people in so that no doses go wasted. We're also thoughtful about how many vials that we open for the same reason.
And I want to go back to Dr. Fielder with Kroger. Doctor, how will Kroger customers know when the vaccine is available? How will you communicate with them?
So we will be very bold when we have enough doses to be bold, right? And so we will have a scheduler tool that will go live as soon as we get doses and that are enough to schedule. The appointments go so quick. I think everyone here on the panel can attest to how quickly their appointments fill up. And so we will, of course, through our various media channels, our website, our telephone system will have the message there to say, in short, we are here, we're ready. and please make your appointment and give that the ways to make your appointment. So it's coming. We know doses are coming, and we're excited and cannot wait to be able to vaccinate more of our Houstonians. And certainly we'll go out into the communities as well, much like we did with COVID testing, various areas around town to make sure that we have more of the community can have access. And we have quite a few of our partners and people that we have relationships with that are ready to go. They're ready. They have their facilities ready. So it should be very good very soon-ish.
Fingers crossed, without a doubt. Dr. Fielder, thank you. Yeah, these vaccination appointments seem to be the hottest ticket in town at this point. Dr. Drews from Houston Methodist, how will folks know when the vaccine's available to them? How will you let them know?
So Houston Methodist patients are being contacted when their tier is reached, but also we have vaccine available to the community in general. We had appointments that people could sign up for, and similar to what other people have mentioned, thousands of appointments that were gone within a matter of minutes. So it will be announced in all of the various methods, by text, phone call, all of the media outlets. So we want to make sure that people know and have access to the vaccine. And similarly, we don't want any vaccine to go to waste. So we want to make sure that as soon as it's here, we are getting it to people who need it.
Dr. McCarthy, I will tell you that I happened to have been sitting at my computer when I got an email on the 28th letting me know that 1B was available and I was in that category. And it took a week and a half or so, until yesterday, for me to get my appointment. But now going forward, how do you let Memorial Hermann patients know? And I know that with the hub system, you're now just kind of putting the word out through media about all of this opportunity as well.
So we're continuing for patients that we know and have contacted us. We will continue to reach out to them. We're looking at new ways that we can have other patients actually contact and register with us, so we can put them into the queue. What we can't do, it doesn't work broadly, and we demonstrated this afternoon. We can't open it up to all of Houston and say, everybody come register. The funnel is just too big. We have to put this down into more discrete bites, and not every hospital system, not every clinic is going to be able to offer a vaccine to all of Houston. None of us have a scheduling system that can accommodate 7 million people all trying to get the schedule at the same time. So having multiple portals of entry and how we solve this as a community is going to be the way that this gets done. So what we will be doing is continuing to reach out to the patients we know, anybody we have contact lists for on review. We're looking to build a portal where people can actually register with us. We piloted that today with NRD. Register with us so that we can then reach out to them, assuring that they're the right group to be vaccinated, and invite them into vaccine as we are able to open capacity as vaccine is available.
Are there any frustrations about lack of understanding when you're going to get the product, for example? I mean, there's no real national system set up. It's all like state by state. You get it, you get a dose, you're waiting for it. Any frustration with that system? I know you're doing the best you all can with it. What kind of frustration do you have with that, if you have any?
I'm grateful we have it. Right? This is something we didn't have 30 days ago. So the fact that the state has been able to distribute themselves to us, great communication from them about what we're going to get the next week. We would love to know what we're going to get for the entire month. We recognize that's not available yet, but this has been, we're building the bus as we move down the road. So I think the communication from the state has been outstanding. I think our partnership has been great, our partnership with other healthcare entities in Houston. So I know everyone wants this today, but we didn't have this 30 days ago. We'll get this out to everyone. It's going to take a little bit of time, but we're all working together. And no, we'd all love to have more than we could give out, but that's just going to take a little time to get this.
Thank you very much. Dolores writes, I work for the city of Splendora. Several of us are over the age of 65. We cannot find any place to sign up for the shots. Can you give us some help? Ms. Garcia, can anyone go to a state vaccination hub even if they live in a different county?
Yes, we have given guidance to all of the hubs that they need to be able to accept people wanting to be vaccinated from some of the surrounding counties. And, particularly with this current week that we're in right now, we did have a limited distribution and only certain communities were able to receive vaccine that time. And so the direction was that you need to be open to having from some of your neighbor counties. As I mentioned earlier, the distribution that we will have for some of those hubs next week, so the week of January 18th, will be much more robust and have a lot more coverage across the state. And so keep in mind that, again, we understand that there is a big desire to get vaccinated as quickly as possible, and we're trying to help you all do that. The supply is where we're getting slowed down. Texas right now is sitting at #1 for doses administered in the U.S. And that's something that is attributed to all of the partners that are on this town hall today and all the hard work that they get done every single day. And so, we do want you all to seek that out in those hubs. But next week, we will have even more sites that will be available to provide access for you all.
Yeah, Ms. Garcia, we don't say it enough to thank our frontline workers during this time. We certainly appreciate your response as well. So to our next viewer, Richard says, I am 65 with chronic asthma and type 2 diabetes. When can I sign up to receive the vaccine? And Mr. Williams, what would you suggest here?
Well, since he's 65 and above and meets the category for 1B, I'm going to give him a number to call. And that is our Area Agency on Aging, and that is 832-393-4301. They will actually help you navigate through our system to set up an appointment. But as everyone has been saying, the supply is very limited, and so it might take some time for you to get in. You can also call our call center at 832-393-4220, and they can help you to navigate the system, or go to houstonemergency.org. So any one of those three avenues should be of some help to you. Also, as vaccine becomes available in the Houston area, we are hoping to open up our registration portal as they become available. Now, that is open to the public, and I have to tell you that when we did that on Saturday for 1,000 slots, that was filled within 15 minutes. That should give you some idea of what the demand is here in the Houston area.
Mr. Williams, real quick, for Richard, can you repeat that first number that you gave? And so it gives, if Richard's watching, he can write that down. And we can also share it on our website as well. We want to be sure that he got that phone number.
832-393-4301. And that is the Area Agency on Aging, and they're using that line specifically for seniors.
Okay, wonderful. Thank you so much.
That's an interesting conundrum, because most of the people who are after the frontline workers, those who are 65 and older, who may not be as up to speed with technology to be able to take advantage of that. Has that been something that's factored in with, for example, the number you gave just now? I saw someone who was upset because whenever they got on and tried to make the phone call, they never got an answer. So talk about the frustration that people might face when they're trying to get through on the phone if they're not really adept at operating in the social media platforms.
I have to acknowledge that last weekend our system pretty much crashed because it was overwhelmed with the number of people that called in. We were able to actually modulate that later on, and so at times, if it's really busy, you might get a busy signal. But we believe that it is absolutely imperative to have a call center or another avenue to make appointments. We realize that some folks are just not tech savvy and they need that extra support.
Mm-hmm. This might be a good question for Ms. Garcia. Leslie Stubbs asks us, says, I'm a retired RN with an active license in Texas that would like to volunteer to give COVID vaccines for free. Please help me find out how I can do that.
So first of all, thank you for wanting to help in our fight against COVID-19. I would probably, my first step would be to link you with Stephen Williams and see how do we roll you into helping vaccinate at some of the mega sites that he's standing up. Because that's definitely a new opportunity that's available in order to help give shots across the city.
I'll add, we are looking for volunteers. We said that we were going to run mega sites, at least one this weekend. And one of our challenges is really having people to actually administer the vaccine. And so we're very much open to volunteers.
One of the things you said, Dr. McCarthy, resonated with me. You talked about building the bus as it's moving down the road. And I think that's what everyone has been saying with the coronavirus. It's something no one's ever done before. And now we're evolving to try to have a solution to this problem as well. Talk about how far we've come and how far we still have to go in order to get to a place where we can feel comfortable and safe again.
So I think, if you go back a little over last spring when we first hit, right? We were all frightened. The hospitals were shut down. We went through the terror of not having adequate PPE for healthcare workers, hospital employees. Were we going to be safe? People hiding in their houses, not sure what we could do. And we learned a tremendous amount, right? We've learned that we can safely get kids in school. We can safely figure out how we can go out and do parts of normal life, go to the grocery store, do that with masks, with social distancing, hand washing. And now we have vaccine. This was unprecedented speed with which vaccine was able to introduce with high quality, safe, effective vaccines. And now we have this wonderful hope. And I know everyone wants it done today, but it is coming. And I think it's just incredible that we are going to, in less than a year from when we were first hit with our first cases in March in Houston, we now are distributing the vaccine that we know is the critical next step in getting us back to normal. So it's incredibly exciting. It's impossible. Nothing in my healthcare career has been even remotely similar to this in terms of a new panic, complete change of life, and a new cure, new prevention, all within 12 months. It's been absolutely incredible.
We're certain that in all of your line of work that you've been probably inundated with questions about the vaccine, about how to tackle the coronavirus, as we here at KPRC2 as well. We're so fortunate to have this entire panel and all of you joining us tonight. Want to give you all a chance, as we have a few more minutes left before we wrap up this conversation, this very important conversation tonight. Any lasting point that you want to make and leave with our viewers tonight regarding the coronavirus, the vaccine distribution? Any last thought?
Sure, I'll just jump in and I'll just say that we can't let up on what's worked so far. The social distancing, the masks, it's so tempting to go visit friends or family and you think everyone's safe because they haven't had any symptoms, and then you come home and you find out later, a couple of days later, that you are positive. And so we just got to stay with it. This vaccine will help us get to where we're all trying to be, and that's back to whatever that new normal really will end up being. And so, also in the meantime, if you haven't already, it's not too late to get your flu vaccine, and it's important because the last thing that you want to do is have a twindemic, right? In the middle of Corona, also have influenza and have additional complications. So it's not too late. I know that because we're wearing masks, we're not hearing about more people getting the flu, which is a good thing, but it's also not too late to get your flu shot. So if I could impart with that is probably one thing that we still can do while we wait for our turn to get the vaccine.
Dr. Fielder, thank you. Ms. Garcia?
Thank you for that. I would totally echo my colleagues' comments and reiterate that. But I think the other piece that I would add that's a little bit different is we're literally making history right now. This is the world's largest vaccination event that we've ever had. And we are going faster than anyone can imagine. We have all of our providers working 7 days a week. We have our local health departments at our state health department. Everyone is going exceptionally fast to get this out to the fields, to our communities as quickly as we can. So I just ask that you all hang in there with us and please be patient. As soon as the doses are coming in, they're flying off the shelves, but more vaccine is coming. And so we just ask for your understanding and your patience with us all across the state as we do this huge historic event.
Patience is certainly key. Certainly it's something for us all to understand. We want to thank all of our guests for joining us this evening and all of you for sending in your questions and tuning in. If you still have questions related to any aspect of coronavirus. You can submit your questions on click2houston.com/vaccine.
Yeah, big thank you to our panel. And for now, from everyone here at KPRC, we wish you a wonderful night. And Chris and I will see you back here on TV and on click2houston.com for our news at 10 o'clock.
Good night.